Hello, my name is Taylor Disch, and I'm a junior in Animal Science Pre-Veterinary Medicine at Iowa State University in Ames, Iowa. Today I'll be discussing with you equine odontoclastic tooth resorption and hypercementosis, or more commonly referred to as EOTRH. So what is EOTRH? Let's break it down to a more simpler format. The E is for equine. This syndrome affects the horse, but similar syndromes are often observed in felines. The O is for odontoclastic, which simply means the teeth roots are being absorbed. As you can see on the two radiographs, one on the left is how a normal horse's lower incisors will look. However, the one on the right, you can view darker areas on the radiograph, which show the tooth roots are being absorbed back into the jaw. Pay special attention to where these purple and red arrows are pointing. T is for teeth. As you've already seen, EOTRH affects the teeth in equine, more specifically the incisors and canine teeth. In horses, there are 6 top and 6 bottom incisors and 2 top and 2 bottom canine teeth. The placement of these teeth can be seen in the diagram provided on this slide. R is for resorption, which means the tooth is being broken down and resorbed. The radiograph on the left shows a very extreme resorption case, with the less severe case of EOTRH represented on the right-hand side. Pay attention to where these red arrows are pointing. You can see those are darker areas on the radiograph, which represents the resorption of the tooth lesions. So these are common cases that you will see, with again the one on the left being a much more severe advanced case. The H stands for hypercementosis, which is the last stage of EOTRH. This means that the cementum, or the hard calcium deposits that make up the teeth, is being deposited in excess. This continuous cementum deposit forms layers which begin to give the teeth a bulbous or cauliflower appearance. This tooth structure can be seen in the radiograph provided, or even more clearly in future slides upon tooth extraction. So really remember this kind of bulb, tulip shape to the tooth, and you'll see once it's pulled out of the horse's jaw that it's very much like a clove of cauliflower. So what signs as an owner will you observe in an EOTRH affected horse? It can be very hard to diagnose. Only in extreme and very advanced cases can hypercementosis, the cauliflower bulb appearance of the teeth, be noted just by looking at the horse's mouth. Some unusual clinical signs would be unexplained weight loss or loss of appetite, oral pain, or unwillingness to accept the bit. In most cases, horses' owners are unaware their horse even has EOTRH unless a veterinarian takes a radiograph. And again, the symptoms and the severity of this case really do not show up until the horse is much more advanced into their age and then into having this syndrome. Who is susceptible? Most commonly, this is seen in aged horses 15 or older. Horses who are over 20 often have the most developed cases with the most obvious clinical signs and visual signs when you actually just look into the horse's mouth. Other than that, you really need to take a radiograph to understand what is happening. The cause of EOTRH is currently unknown, which is why it's called a syndrome. Histology and microscopic evaluation of removed teeth leads researchers to believe it is not viral, bacterial, or pathogenic. So it's not something the horse will catch. It's something internal that is happening. Only form of treatment for EOTRH is the extraction of all affected teeth, which can be kind of shocking to tell an owner is that you are going to remove all of their horse's front teeth. Most commonly, all top and all bottom teeth are extracted. This does not impede the horse's ability to eat or be ridden in the future. This topic will be discussed more later. In this radiograph, observe where the red arrows are pointing. This area has lost the bony supports to the incisors. Teeth like this will become loose and painful, and then you'll often see the hypercementosis coming in preceding this, and you'll get that bulbous appearance to try and stabilize the teeth. This radiograph summarizes the entire component of EOTRH. Hypercementosis and resorptive lesions can be seen. So now let's look at what you might be viewed in a horse's mouth. Both of these cases show fairly progressive severe cases of EOTRH. The image on the left of the 21-year-old horse shows some of the beginning observations of EOTRH that might be made. The swelling and receding of the gum line can be noted. The image of the 24-year-old horse is a case of severe EOTRH, which the teeth have begun to shift position in the mouth because the bony supports of the incisors are missing. Additionally, the resorptive lesions of the tooth roots are in a more severe stage. Some of the hypercementosis can be observed, which is thought to be a possible way to stabilize the teeth once resorptive lesions and odontoclastic absorption of the roots occurs. And in this you can see that really kind of swollen gum line, and it's receded. You can see the teeth have shifted positions. They're not quite as much in a line as this 21-year-old horses are. And you can see that puffiness, which again would be swelling, and then also you have some of that hypercementosis going on behind the gum line. This photo here is a photo that I myself have taken of the removal of top 6 incisors of an EOTRH affected horse. This horse was about an 18-year-old Arabian, had a fairly severe case. Make note of the clear bulb cauliflower shape that has been seen on previous radiographs that you've been seeing this whole entire presentation. But now you can really see how bulbous they are. And now these teeth are very hard. They're not soft or anything else. This is a very hard cementum, again, where these bulb and cauliflower shapes are located. So let's talk about life after surgery. After surgery, to remove all 6 top or all 6 bottom incisors, the horse will live a completely normal life. Within a few hours of waking up from general standing anesthesia, the horse is able to eat solid foods. Equine adapt fairly fast to learning how to use their lips to grasp and pull up grass on pasture. The molars are used for grinding the feed, so this really does not impede their ability to eat. Within 2 to 3 weeks, horses can resume being ridden with the bit in their mouth. This image is just showing one of those side incisors being pulled out and what that will look like. So they do, it's a very kind of deep surgery to do, and it's a very unpleasant thing to look at. And then the horse does look like they wear dentures after a while with their lips sinking in a little bit, but they really do adapt very well to having those incisors removed. And oftentimes if they have had weight loss or the inability to eat, they gain weight right away, and they are much happier. If EOTRH teeth are not removed, complications can ensue, such as ulcers, tooth impactions, or even fractured teeth, which can all lead to more serious and costly health problems. So you can see on these photos that the one on the right, there is a clear fracture to the tooth. The one on the left, there's that impaction where part of the tooth has actually fallen off, and now we have grass and feed coming in and making layers on top of that, which can cause infection. So it's really important that if your horse is diagnosed with this, even though it's unpleasant to think about them having those incisors removed, that they do get removed, because otherwise you can have much more serious health problems. Veterinarians and researchers are currently hard at work searching for a solution to treat and find a cause of EOTRH. Microscopic anatomy and histology is an important tool for finding the causal factor. So often when horses have their teeth removed, they are then sent to a lab to have tests run to see if we can really pinpoint anything that is a causal factor. These are some microscopic slides of slices of the teeth of EOTRH. The best way to prevent a more severe complication of EOTRH is to have routine dental checks done by an equine veterinarian specializing in dentistry. These photos are of Dr. Molly Rice of Midwest Equine Services. Dr. Rice solely works on equine teeth and is considered an expert in her field. Dr. Rice is actually someone who I myself has shadowed and is the one who helped me learn about EOTRH in addition to the photo that I myself took previously shown in this presentation, she is the one who removed those teeth from that horse affected with EOTRH. So in the end, the moral of the story really is, always look the gifted horse in the mouth. Thank you so much for listening to my presentation today.